Our next speaker. For more than 20 years, our next guest has worked to improve the lives of Riverside County, California residents as an elected official and as a teacher at Rialto High School. That commitment also extends to our nation's veterans who know him as the chairman of the U.S. House Committee on Veterans Affairs. His grandparents were removed from their respective homes and sent to Japanese-American internment camps during World War II. The families would later settle in Riverside County, where our guest would graduate as high school valedictorian in 1979. He attended Harvard College and earned a bachelor's degree in government in 1983. Ladies and gentlemen, please give a warm American Legion welcome to the Honorable Congressman Mark Takano.
Thank you very much. Well, good afternoon, everyone. I am Congressman Mark Takano, Chairman of the House Committee on Veterans Affairs, and I'm honored to join you all today. And I want to thank National Commander Oxford for inviting me. It's been so long since I've seen many of you in person, but I'm glad that the American Legion has brought us all together again. Now, as chairman, I know of no group more resilient to the upheavals in daily life in our nation, than our nation's veterans, and these past 2 years have been full of upheavals. The COVID-19 pandemic has upended our lives and added so much uncertainty. We communicated with our families and friends through screens and went to medical appointments in our own homes, and many veterans endured excruciating delays in benefit claims and home care services, and thousands contended with job losses. Our country was forced to adapt. And now, after nearly 20 years of service and sacrifice in Afghanistan, our U.S. forces have officially withdrawn. And I know that old wounds have reopened for many veterans and their families, caregivers, and survivors as the world watched the horrific images coming out of Afghanistan. But our service members accomplished something miraculous. They safely evacuated more than 120,000 Americans, Afghan allies, and citizens of allied nations in the largest airlift in U.S. history. My heart does break and has broken for the 13 service members lost in terrorist attacks in Kabul last week. The families of the service members killed and wounded are experiencing unimaginable pain. But they should know that their loved ones saved countless lives in the evacuation efforts. This service was necessary, courageous, and it will be eternally valued. In the days and weeks following our exit, we must remember that compressing 20 years of our involvement in Afghanistan into 3 weeks of evacuations was always going to be messy. But this does not diminish the honorable service of the hundreds of thousands of veterans who answered our nation's call and left behind their families and communities. Our service members, past and present, performed and served with honor and never lost sight of their duty. And for all who served or supported us in Afghanistan, we thank you. There will be a time to sort out what could have gone better, but today we must remain focused on assisting Americans and Afghan allies who have been evacuated and those who are still seeking refuge. Ending the military mission was the best way to protect the lives of our troops and allow innocent civilians to leave in the weeks and months ahead, and I commend President Biden for taking this critical step. I've heard from many veterans desperate to help their Afghan translators and colleagues that supported them during Operation Enduring Freedom and Freedom Sentinel. We remain forever grateful to those who have and continue to serve so selflessly and the families who made that service possible. Our thoughts are especially with our Gold Star families and those who bear the wounds of war. This is a difficult time for many who served and those who supported their loved ones in Afghanistan. Please join me in reaching out to those veterans in your lives. Check in with your buddies, and if you need help, please know that it is okay to not be okay right now. VA's crisis line is always there at 1-800-273-8255. Now, I'm acutely aware of the service and sacrifice you have all shown throughout this pandemic and the withdrawal from Afghanistan, and you have continued to serve your communities and the brave allies that supported you despite all the unknowns. But this resilience has not meant that these long months were less of a challenge. So I want to thank all of you here in this room. Now, it's really time to say that hope is on the horizon. We have a safe, reliable COVID-19 vaccine, and because of my bill, the Save Lives Act, VA has the authority to vaccinate all veterans, caregivers, and veteran spouses for this and future pandemics. Now, VA quickly became a national leader in vaccinations with this expanded authority, and I'm glad I could work with VA to ensure that all of you could get a vaccine as soon as possible. And please, if you haven't already, I strongly encourage you to get the vaccine. Because of the American Rescue Plan, we have provided VA with the resources needed to handle the influx of patients as many delayed care due to the pandemic or have come to rely on VA even more. And as compensation and pension exams were delayed, we provided additional resources to help the National Personnel Records Center and VA get through the backlog so veterans and their survivors can access critical benefits. We work with VA to waive co-pays for veterans seeking care during the pandemic. There is no surprise bill coming your way, and if you already paid your co-pays, VA will reimburse you. We were also able to provide emergency funds to help student veterans as their schools closed due to the pandemic. Now, the pandemic showcased some of VA's triumphs, including the success of VA's long-term care and its ability to adapt to a global pandemic, and even expand its mission to care for to expand its mission to care for civilians during the national emergency. And while our nation's nursing homes and state veterans homes were hit particularly hard by the pandemic, VA's own community living centers experienced minimal outbreaks and spread of infection. It quickly became clear that VA has the know-how and experience, exemplified by its talented medical staff, to provide superior long-term care. And I'm so grateful these providers could share this wealth of knowledge through VA's fourth mission. I'm certain that this support to nursing homes and state veterans homes across the country saved lives. However, it also spotlighted issues with accountability and VA's limited oversight authority over state veterans homes. VA provided key emergency funding, or actually Congress provided key emergency funding for state veterans homes in the CARES Act and the American Rescue Plan. But I wonder whether VA should be doing more to help ensure these facilities deliver safe, effective, high-quality care, and how to best invest VA funds for construction and renovation of these homes. And that's why I'm considering legislation to require state veterans homes to meet Medicare requirements for skilled nursing facilities, employ licensed long-term care administrators, and to update VA's standard for construction of these homes. We must learn the lessons from this pandemic and rethink VA's relationship with state veterans homes. We simply cannot allow the disastrous and deadly incidents that occurred in some state veterans homes to happen again. And I know there are certain states that are represented here that were particularly hit hard. As the pandemic subsides, there is still much more we have to do, and I look forward to our continued partnership. We will continue to have a busy Congress, and while we keep responding to the pandemic, we must make progress in other key areas. And that's why I've directed my committee to prioritize 9 issues: to create a more welcoming VA and build equity for veterans, address toxic exposure, reduce veteran suicide, ensure student veterans receive quality education, support VA's long-term care, advocate for women, modernize VA, improve VA's management and oversight, and ensure our legislative accomplishments are implemented effectively. The foundation for all of our work depends on creating a VA that is welcoming and safe for all veterans that enter its doors. Our veteran population is rapidly changing, with more women, LGBTQ+, Black, Asian, Hispanic, and Native veterans than ever before, and it's clear that VA needs a cultural change, and I believe that we have seen so far that Secretary McDonough is making efforts to lead VA in that direction. No veterans should face barriers accessing the care or benefits they've earned, and no VA employee should face discrimination in the workplace. We have to look back to learn about past disparities to figure out how VA can rectify them, and work to ensure that all veterans, regardless of gender, sexuality, gender identity, race, housing status, or citizenship, can access VA equitably. Now, this will take hard work, and VA cannot do it alone. Giving emerging information about troubling connections between the veteran community and domestic violent extremist groups, we need to rebuild bridges to veterans who may feel that they are outside the community. And that's why my committee started looking into these groups last fall to better understand why domestic violent extremist groups specifically target veterans, and how all of us, Congress, VA, and our VSO partners can be a part of the solution. We have a duty to rehabilitate these veterans and bring them back to the VA community. Together, we can work to support women veterans and ensure all feel safe entering a VA facility by eradicating sexual assault and harassment at VA. Last Congress, we passed the Deborah Sampson Act into law, making huge progress, but there's still more to be done. We can help our nation reckon with the effects of discriminatory military policies and undo the damage that has been done to LGBTQ veterans since Don't Ask, Don't Tell. My legislation to establish an LGBTQ commission can help rectify the injustices and create a more welcoming culture for LGBTQ service members and veterans in the military and at VA. And I want to thank you for standing with me on this legislation. We must not leave anyone behind in this work, including our deported veterans. Despite serving our nation honorably and bravely, non-citizen veterans are still exiled from the country that they call home and fought to defend. They face significant barriers to access the benefits that they are entitled to and eligible for under the law. So I reintroduced the Veteran Deportation Prevention and Reform Act because their service matters too. And I want to thank the American Legion I just want to say that that is so meaningful to hear that coming from this hall. And I want to thank the American Legion for supporting this critical legislation, and I want to thank you for your commitment to honoring the promises we made to our veterans regardless of their citizenship. Similarly, I introduced the Korean Valor Act because we have a moral obligation to support our Korean American veterans. My bill would correct a decades-long gap in VA's Allied Beneficiary Program and begin to rectify significant inequalities between our European and Asian allies living in the United States. For 63 years, veterans of Allied forces from World Wars I and II have been able to enroll in VA healthcare. Yet today, veterans of the Republic of Korea who fought alongside us in the Vietnam War and who also went on to become U.S. citizens, they're denied what their European counterparts already have access to. That is, access to veteran-centric, high-quality care from VA. Over 300,000 Koreans fought alongside the United States in Vietnam. Nearly 3,000 of these veterans are now United States citizens, but exist in a limbo, unable to receive care from either the Korean healthcare system or VA. Providing care to these veterans will set a crucial precedent that Americans stand by their allies and welcome them with open arms. My intent is not to focus just on one group. My intent is not to focus on just one group, but to adopt a global posture towards supporting our allies. Our veterans are our best ambassadors of American values, and by taking care of these 3,000 Korean American veterans, we can sustain our alliance with a crucial ally and advance American ideals around the world. Now, I'm determined to make good on the promises that we have made to our veterans. And every day I hear from more and more veterans living with the effects of toxic exposure. And I'm sure many of you here today have been affected as well. For decades, we haven't honored our promise. Instead, we have tried to address this issue one disability or one location at a time, often leaving many veterans behind. In the last Congress, I was proud to lead the effort to finally pass the Blue Water Navy Vietnam Veterans Act. And by the applause, I can tell you all know that this was a major accomplishment. And I could not have done this without you and the other VSOs, others in the VSO community, but this victory is bittersweet. Our Vietnam veterans shouldn't have had to wait over 40 years to access the care and benefits they earned. And for many, it was too late. I'm going to tell you right now, I will not let our post-9/11 veterans suffer the same fate. The cost of war is so much more than just the tanks and guns used in the heat of battle. For the veterans living with toxic exposure today, they still are in the heat of battle. And they're paying the price that our nation should be paying. When we send our service members into harm's way, we do so with a promise to care for them and pay for that care when they come home. My honoring our PACT Act finally recognizes toxic exposure as a cost of war. And I'm so grateful to have the support of the American Legion. Our bipartisan bill will finally provide health care to more than 3.5 million veterans exposed to burn pits and airborne hazards, and will concede exposure that is long overdue. It will establish a presumption of service connection for 23 respiratory illnesses and cancers, and crucially, it will overhaul VA's presumptive decision-making process so Congress does not have to keep intervening. Now, I was pleased to see Secretary McDonough take action to begin processing claims for veterans experiencing asthma, rhinitis, and sinusitis following exposure to toxic substances, and finally recognize these conditions as presumptive. But this is just one piece of the puzzle. 2021 will be the year we pass comprehensive legislation to address the needs of all toxic exposed veterans. With a VA secretary committed to this issue, wide VSO support, including the American Legion, and a president whose own son may have been impacted by toxic exposure, I believe we have the momentum to get this done. Especially with Afghanistan fresh in our minds, we cannot forget the promise we made to these veterans. And I know one of my top priorities is also yours: veteran suicide prevention. The American Legion has been stalwart in calling for its members to be there for each other and with Buddy Check Week, And I commend you for this constant reminder that connecting with each other is one of the most protective ways we can support veterans' mental health and well-being. This is especially true given the latest news from Afghanistan. In the 116th Congress, the committee worked tirelessly to develop and pass the Veterans Compact Act and the Commander John Scott Hannon Veterans Mental Health Care Improvement Act into law. These bipartisan bills were incredibly strong first steps to reduce veteran suicide, but as long as 17 veterans die by suicide each day, our work must continue. And this year, we've continued our efforts and already passed Representative Axney's Sergeant Ketchum Rural Veterans Mental Health Act into law to increase access to mental health care in rural communities. I also know that one of the most stressful periods for service members occurs during their transition to civilian life, and that's why I introduced the Ensuring Veterans Smooth Transition Act, or EVEST. By automatically enrolling veterans into VA care during their transition, we can ensure that they are connected to the VA system and its critical mental health resources, hopefully preventing these veterans from falling into crisis. Now, VSOs, including the American Legion, have been fighting for this for years. And I'm grateful to have you behind my bill. And with this very simple step, we can make VA's resources more accessible to veterans at a time that is known to be very difficult. Guided by evidence-based approaches, we will continue to fight for expanded lethal means counseling for all veterans, cultural competency for community providers, and increased outreach to some of our most at-risk veterans, including women, LGBTQ+, and Native veterans. Now, we have big goals for this Congress: to create a more welcoming and equitable VA, to finally recognize toxic exposure as a cost of war, and make meaningful progress in the fight to reduce veteran suicide. And if we're going to move forward on these goals and build back veterans' trust in VA, we have to start making serious investments in the federal agency meant to serve them. And that's exactly what President Biden's Build Back Better plan will accomplish. As many of you all well know, most VA hospitals are over 50 years old, and it's clear there are places where the infrastructure of these buildings is failing our veterans. Chronic underfunding of VA's capital asset portfolio has left the department trying to deliver 21st century health care in buildings designed to serve veterans who fought in World Wars I and II. This is simply unacceptable, especially as VA's footprint will need to increase even further to care for an expanded population of toxic exposed veterans that will rely on VA for their health care. So we need to start building that capacity, both in terms of brick and mortar infrastructure and human capital. The $18 billion set aside for VA in the Build Back Better plan will allow us to restore veterans' faith in VA by literally rebuilding the physical infrastructure of the VA system, investing in VA's workforce, and providing much-needed updates to support structures that serve our veterans. Now, I'm optimistic about the future of the VA, and I know that with the support and insight of veteran service organizations, Secretary McDonough and President Biden, we will be able to fulfill the promises that we've made to our veterans. Together, we can build a stronger, more welcoming, and more effective VA. Our country may not be perfect, but it is full of promise. And veterans know that that is worth fighting for. So thank you for having me. Thank you for your advocacy. Thank you for all of your service. God bless you, and God bless the United States of America.